Hello, and welcome to the MIMOSA Matters podcast series. In this series, we will bring you interesting perspectives on the clinical, research, and technological perspectives for near-infrared spectroscopy imaging, or NIRS, and introduce you to MIMOSA Diagnostics. I'm your host, Douglas Queen. Today, we are bringing you a MIMOSA Matters Poster Chat, where you can learn from our collaborators about their important research. Thank you for tuning in and joining us on today's podcast. We will be hearing from Professor Alisha Oropallo, Professor of Surgery at the Donald and Barbara Zucker School of Medicine in New York in the US. She is a practicing wound care specialist and completed a vascular surgery fellowship at Boston University Medical Center. Her major areas of interest are in the pillars of education, research, quality of care, and community outreach. Welcome, Alisha. Let me start our conversation by asking you a few questions about your poster entitled Efficacy of Minimally Invasive Vascular Interventions Assessed with Mobile Multispectral Near-Infrared Spectroscopy Imaging, such that our listeners can get some insight into your experience with NIRS imaging. Tell our listeners a little bit about your clinical practice and experience.
Thank you, Douglas. Yes, my clinical practice, I'm basically a vascular surgeon and a general surgeon. I also have a niche and a strong interest in wound care. My background lends itself to the integration of education to our residents and staff, as well as other pillars such as research and also the development of the interdisciplinary team, inpatient and outpatient, in which I work with many nurse practitioners, residents, medical students, podiatrists, and other allied clinicians.
Give our listeners some background into the study featured in your recent poster at the SAWC Spring conference.
Yes, this study focused on using near-infrared spectroscopy imaging to assess the effectiveness of minimally invasive vascular interventions for chronic venous insufficiency. Chronic venous insufficiency is a prevalent condition, and while treatments like sclerotherapy and radiofrequency ablation are common, there needs to be a better way to evaluate how well they'll work. So traditionally, duplex ultrasonography has been used, but it's time-consuming. And so near-infrared spectroscopy imaging offers a non-invasive alternative to measure the tissue oxygenation and potentially streamline these assessments.
Great. And what was the main driver for the study?
I would say the main driver of this study was to investigate the utility of near-infrared spectroscopy imaging as a non-invasive tool for assessing treatment outcomes in patients with chronic venous insufficiency. More specifically, the researchers aimed to use near-infrared to measure changes in tissue oxygenation before and after minimally invasive procedures like foam sclerotherapy or radiofrequency ablation, but really to see if it could improve or provide some more efficient way to evaluate the treatment efficacy.
And what was the outcome of the study?
The study showed that near-infrared spectroscopy imaging can effectively monitor tissue oxygenation changes following minimally invasive vascular interventions. More specifically, the post-treatment NIRS data showed an average of 20% increase in the mean tissue oxygenation on the plantar surface of 93% of all cases, and the mean tissue oxygenation increased significantly from 53% pre-treatment to 73% post-treatment, and that was statistically significant with a p-value of less than 0.05. Also, I would say that successful vein closure after radiofrequency ablation and sclerotherapy was confirmed in all 14 cases using postoperative duplex sonography against that gold standard.
Great, thanks. The poster highlights a few of the 14 patients studied. Why were these particular cases chosen for the poster?
These patients were chosen for specifically because they aligned with being able to assess pre and post treatment. So we could look at assessing using the device pre-treatment, measuring the tissue oxygenation, and then post-treatment.
Great, thanks. And how did NIRS imaging help with this study?
It provides a non-invasive method for real-time monitoring of tissue oxygenation. It allowed us to visualize the microcirculatory changes and detect whether there's a treatment success or a potential failure by measuring the tissue oxygenation before and after the intervention. I feel it also offered a way to quantitatively assess the impact of the treatment on the tissue.
Great, thanks. And what is the key message of the poster that you would share with your clinical colleagues?
I guess, Douglas, the key message would be that near-infrared spectroscopy imaging shows promise as a valuable clinical tool for assessing outcomes following minimally invasive vascular interventions, especially for chronic venous insufficiency, which many of our clinicians see on a day-to-day basis with venous leg ulcers. It offers a non-invasive way to monitor this tissue oxygenation and potentially allows for earlier detection of treatment success or failure, as in this case. And this could potentially lead to more timely and effective interventions. And we know that early intervention with venous insufficiency, such as utilizing radiofrequency ablation or intravenous laser vein ablations or sclerotherapy, so forth, can make a difference in the patient's outcome and in the successful rate of increased rate of wound healing. But overall, I feel that also further research with larger studies is needed. But the near imaging has the potential to optimize these vascular treatment outcomes.
Great. Well, thank you, Alisha.
Thank you for having me.
Thank you, Professor Oropallo, for giving our listeners an in-depth insight into NIRS imaging, MIMOSA Pro, and its utility in clinical practice. Well, that's our poster chat for today. We hope you gained some new perspectives on NIRS imaging and its utility in wound management. Be sure to visit MIMOSA Diagnostics at www.mimosadiagnostics.com and visit our social media channel. Add your comments and learnings. We want to hear from you. And check out our MIMOSA Learning Plus section on our website for more poster chats and posters and white papers.